everybody. My name is Alexander Bernhard. I'm a CT surgeon from Hamburg in Germany. I'm currently the CT surgery PC chair. And on behalf of ISHLT, I would like to welcome you here for the PC community town hall meeting for the CT surgery. I know that not everybody is a member, so I tried also explain a bit the structure of ISHLT where appropriate. So the agenda for today is to give you an overview of the current incoming professional community leader group, some membership statistics, and some highlights for the community at the Boston ISHT annual meeting, especially with a focus on the pre-meeting day, the academies and workshops we plan there, and some discussion and questions if you may have some. So these are the current CT Serial PC community representatives. I'm the chair, Shiva, Dave, Nico. They're rotating out. Pablo, Caitlin, Scott, and Ezekiel. They will stay on the CT surgery PC. Will stay representatives, and the incoming ones I would really like to welcome also here: Roxana Moyadefia, Maurizio Villavidencio, and Julia Reband. They will be the representatives for advanced heart failure and transplantation, advanced lung failure and transplantation, and MCS. I give you some insights about the memberships of the ISHLT. Majority of members are cardiology they have their first PC said they are cardiologists or associated to them, followed by CT surgery and pulmonologists. And we have also some non-physician PC members, and you see them here. Pediatrics are of course physicians, but it's also a pharmacy, it's nursing, for example, and this is growing over recent years. And also, and this is what I mentioned on here on the left side. So it's the amount of non-physician members is growing, and also what is growing is members from non-North American countries. So we have Koichi, for example, here. So we are looking really for new members from Asia Pacific, from South America, also from Africa. So please join the society. And if you look into the IDNs, the ISHLT is not only structured by professional communities, but also structured by interdisciplinary networks. The majority of members, they are associated to advanced heart failure and transplantation, followed by advanced lung failure and transplantation, but also MCS. And ISHLT is more and more looking also into acute heart failure and shock. So not only looking in the advanced heart failure and transplantation, but also in the acute heart failure. If you come to the ISHLT annual meeting in Boston, which will be end of April, there are some PC meetings scheduled, as you can see it here. It's 6 to 7 p.m. And on the different days depending on the PC. And then there is an IDN. There are IDN breakfasts at 7 a.m. in the morning, Monday and Tuesday, MCS and PVD on Monday and Tuesday, advanced heart failure and transplantation, advanced lung failure and transplantation on Tuesday morning. I already mentioned the pre-conference workshops. They are on Saturday, 26th. It's the ISHLT, an international CTEF association, CTEF conference. They focus on new techniques, on treating CTEF, new radiology techniques, and on a very patient-based and case-based discussion on CTEPH. Marit Kanva, Phyllis Bilia, and we are hosting the Cardiogenic Shock Academy. We try to, focus on different approaches to treat cardiogenic shock. And this is unique. This is the first time the ISHLT is hosting the Cardiogenic Shock Academy here. We also have a hands-on session that we can really go into detail in managing patients with cardiogenic shock. Then there is the ISHLT Lung Failure and Transplantation Core Academy for those who are interested in to get an in-depth knowledge of how to treat advanced lung failure and transplantation. This is the right academy for you. And we know that diversity, equity, inclusion, accessibility workshop, this has been very successful last year. And again, this will be hosted this year, and we hope it will be the same success as we had it last year. The professional communities, they also host some also a PC community webinars. They have been very successful when we talk about the CT surgery PC webinar, especially if you can see it here, was a very successful one in terms of the registered accountants and live attendance, and also YouTube views. We focus on enhanced recovery after cardiac surgery in advanced heart failure patients and lung failure patients, so also looking into lung transplant patients. And the next CT surgery PC community webinar will be hosted end of March probably. We have not scheduled the meeting yet, but we will announce it via social media and also the ISHLT homepage and let you know when it takes place. But there are also other very interesting ones. You can see them here. They you can see them also on YouTube if you're interested in them. And there will be some scheduled in February and in March. And Greg also wrote in the chat, I think everyone has seen it. There's another hands-on course also for the first time in Boston at the annual meeting. It's a thoracic organ recovery course, and it's especially for younger surgeons or fellows in surgery who want to get an hands-on training in recovering organs and retrieving organs. So if you have any questions, feel free to ask them now in the chat or directly, or email either myself, the representatives, or ISHLT staff. And we are really looking forward to get into discussion with you, talk to you, and hopefully for those who are not yet a member, that you become interested becoming a member of ISHLT. Thank you very much.
If I may jump into the discussion, I thank you very much, Werner, for this. Alexander, this is really interesting and impressive about the numbers. I think that I would be really interested. I thought about so many times about the becoming member of the ISHLT. I think this is certainly a right moment, as you pointed out. I think that the combination of acute heart failure and chronic heart failure is getting more and more into the practice. So I think we have really to work on that. I think that the ISHLT made so many interesting, important initiatives. And therefore, I really look forward to becoming a new member and also be active and in any initiative, scientific or clinical, you think is appropriate. So for me, full support and full interest.
Thank you very much. I mean, Greg, I don't know if you want to add anything here or if you want me to comment on that. So it
Please.
wasn't. No, it was Roberto. You know how much I appreciate what you have done for the field of acute MCS. So with also, for example, I think this is a great opportunity to bring both societies together to get your expertise also into the society. So thank you very much for joining, and I think this is great to collaborate in the future.
Yeah, absolutely. And I would be really not only interested, but really grateful if we could really work together. So really full support from my side, and I will start my application for membership as soon as possible.
Fantastic.
Thank you.
Sorry, I have to take.
Are there any more questions? Well, if there are no questions, Greg, I don't know if you want to add anything from the ICE-HLT perspective.
Well, thanks everyone for your time and for being here, and thank you for your leadership, fantastic leadership of the CT surgery professional community this year. I'm very much looking forward to the meeting in Boston. We expect over 4,000 people to come to the meeting. We had a record number of abstract submissions, well over 2,000 abstract submissions. So it's going to be a great meeting, and I look forward to seeing you all there.
Great. Thank you very much. So I cannot add more than welcome everybody in Boston in a few weeks. And until then, have a good time. Thank you.